Hello everyone, my name is Rachel and I am the Research Communications Manager at Blood Cancer UK. And today I am joined by Dr Karthik Ramasamy, who is a consultant haematologist in Oxford. Welcome, Karthik. And we are going to talk all things vaccine effectiveness in myeloma. So Karthik is leading one of our vaccine effectiveness studies called PREPARE. So over to you, Karthik. Can you tell us a little bit more about your study and what you found so far?
Thank you, Rachel. Thanks for the invitation, and thanks to Blood Cancer UK in really galvanizing a task force to study vaccine responses across blood cancers. And as you know, we have set up a project by the name PREPARE. What we're trying to set out is really study patients' experiences through the COVID-19 pandemic, and these are myeloma patients, as well as understand responses to vaccines, what type of vaccine they've had, and what type of responses they're getting. We're studying both antibody responses as well as studying a T cell or the immune cell response to the vaccines. This is going to be a study which will run definitely up till the end of this year, and maybe even longer than that because of the news we're hearing about that we're going to live with the virus. But we want to get some initial results of what has happened following the first 2 shots of the COVID-19 vaccine with regards to response in myeloma patients.
That's great. And you started to show some initial results, haven't you? What do they show?
So our initial results, the first thing I would say is we now have over 300 patients who have signed up to this study, which is fantastic. As we all know, larger the number gives us more surety about the results that we would report. We have analyzed data from the first 110 patients, and what we're looking at is a number of different features. The first thing, which I guess is more important for blood cancer patients because they've all been shielding, and particularly for myeloma patients who are on continuous active therapy, we have identified that there's been a large-scale change to their clinical care. We've also identified a very high level of shielding-related onset of anxiety and depression, which is rather concerning. And therefore, moving forward, we need to have solutions for them to be able to engage more normally and be able to have the treatment that is useful to control their disease. So we came out with quite a lot of qualitative research data, which we hope will be very useful for clinicians and patients themselves to care for over the pandemic. The next important thing is we started to get some early data around responses to the vaccine. The first set of data that we have is in the first 100 odd patients. We've got data on up to 40 patients who have had a vaccine, the first shot of the vaccine, and we've looked at antibody responses. Approximately about 60% of patients are producing a level of antibody, which according to the assay that we use, has been suggested as a level that would be expected as a good response. We have to be very careful with what is good, what is bad, because there are many different assays, but we think that there is a reasonable response in up to 60% of patients. What we want to see is after the second dose of the vaccine, whether the 60% of patients are maintaining the response and whether the rest of the 40% of people are actually improving their response after the second dose of the vaccine. We are also interested in finding out whether in parallel as the antibodies are being produced in response to the vaccine, whether patients are also having active immune cells, the T cells circulating in the blood as well. So that's going to be the second wave of results, which we would hope to have by the end of August for these patients, but not just the first 100 patients, but actually for the whole 300 patients is what we hope to do.
That's really great. And yeah, it'll be really interesting to see T cell results too. And you've just answered my second question because I was going to ask you when we can expect to hear more, but end of August. So that's great. And for everyone watching, we will definitely keep you updated on the results from PREPARE. We keep close on this, don't we, Karthik? And I guess, so my last question to you would be, you know, what are you telling your patients in clinic at the moment? How cautious should they be?
Unfortunately, Rachel, as we all know, we are gathering data at this time. Whilst we're gathering data, we're also gathering more information that the Delta variant is getting more and more prevalent in the population. So unfortunately, I continue to be very cautious in how I advise my patients, and therefore their kith and kin. So because it's a family unit. Clearly, all people are now vaccinated, particularly the adults that our patients live with, which is helpful. But because of the very high prevalence of the Delta variant, and it's not 100% protection that these vaccines offer, despite about 60% of people already showing antibody responses, I've asked them to stay careful. But what about being careful mean? Well, I mean, clearly you can't be shielded. We know the effects of shielding, but it's about making careful lifestyle choices about who they interact with, who they let in the house, what are all the activities that they engage with, where do they go, and wearing a mask. I mean, clearly we know that on the 19th of July, vast majority of the population may choose not to wear a mask, but I have recommended that our patients continue to wear personal protection and be very careful, as they're going out and interacting with people. So there is a real concern, but we hope to have more permanent solutions for patients. And that's where part of this vaccine task force job is. We want to generate high quality data. We want to be able to signpost our patients to actual clinical trials that may start up later, which may give hopefully even a better additional benefits in the form of improving their antibody levels and so on in the future. So there'll be work to be done, but unfortunately I have been advising my patients to be very cautious, particularly because of the rise in the Delta variant in the community.
I think that's really great advice. Thank you, Karthik. Thanks for joining us. And yeah, we will keep you updated on Karthik's work as and when it comes.